Erectile dysfunction is a very important issue. People often ask me about it, and I'd like to explain it in a slightly simplified way. But before we get into what it is, the causes of erectile dysfunction, the tests, and what the treatment is, we first need to understand what an erection actually is. So how does it happen? Well, inside the penis, there are two tubes, and we call these the corpora cavernosa. These two tubes, for an erection to be better, blood needs to be pumped into them and fill them up, just like what happens with a sponge. So, when the sponge fills up, its size increases, and as it fills, it expands. This is the beginning of an erection. What is the blood that can enter after the blood leaves? What makes the erection last is that when the blood vessels or the corpora cavernosa fill with blood, they press on the veins in the penis. This prevents the blood from leaving the penis, so blood enters but doesn't exit, and that's how the erection is maintained. So, that's basically how an erection works in simple terms. Now, for it to happen, to achieve a good erection, we essentially need 4 key things: strong desire, healthy blood vessels, healthy nerves, and the presence of proper hormones. These specific factors represent the 4 cornerstones, or the essential elements that are required for it to happen successfully. So what are the causes of erectile dysfunction? There are actually a lot of causes, because many different things can affect those 4 factors. The most important of these is desire, and that's where psychological reasons come in. So if we have any stress, anxiety, worries, or problems, or anything like that, it will definitely affect it. It will affect the erection. There are many chronic diseases that can impact those 4 factors. Among them is diabetes, as well as heart disease, high blood lipid levels, and chronic kidney disease. There are actually many chronic illnesses that affect erection, and there are also many medications. Some of the medications we take might also affect erection by impacting one of those 4 factors. There are also surgeries that can affect erection, especially surgeries involving the pelvis, as they can impact the blood vessels or the nerves responsible for erection. So these are the causes. Now, what tests do we perform, and how do we determine the cause of erectile dysfunction? The first thing we need to do is have a thorough conversation with the patient to rule out psychological factors. As we agreed, this is one of the most common causes, and it's one of the most important things we see very often, especially in young people. Yes, psychological issues, mental factors that affect erection. The second thing is we examine the patient. We make sure the size of the testicles is normal, that the penis has no problems, no fibrosis, and no internal issues. Then we start running tests. We do blood sugar, lipid profile, kidney function, and liver function tests, just like a checkup to make sure everything is okay, as we said. As we agreed, the 4 things we mentioned. Now, how do we treat erectile dysfunction? We agreed that the first thing is to treat the underlying cause, meaning we first look for the cause and treat it. That's number 1. Number 2, we start by administering various types of medication to provide much needed assistance to the individual. These treatments begin with oral medications in the form of pills, the most widely recognized and famous of which is, of course, Viagra. These are substances that help with vasodilation, that is, the relaxation of the blood vessels in the penis so that more blood can flow into them. More blood. We start with the initial medications and gradually increase their dosage until we reach the maximum. If the pill treatments fail, we move on to the next stage. Instead of taking pills, we use local injections into the penis, which they have the same action as the pills. But they are local treatments, and honestly, they don't suit everyone because the patient has to inject them himself. He has to learn to inject himself. Some people are very happy with this and have no problem with it at all. Also, if this stage fails, then we resort to implanting prostheses. Implanting prostheses is the last option we turn to. We only consider it after trying all the other options, so no one should come in the first time with just a bit of erectile dysfunction and say, "Doctor, I want to get a prosthesis." No, it doesn't work like that. There are tests and initial treatments, there are pills, there are injections, and we do a Doppler ultrasound on the penis to find out if there's a vascular or venous leak or not. There are actually a lot of things that need to be done. Before we decide to implant a penile prosthesis, we have to be sure. If you found this video helpful, in the next video, God willing, I'll tell you about the types of penile implants. Subscribe to the channel, and I'll see you in the next video, God willing. Peace be upon you.